this is something that's going to be really, really interesting. We all talk a lot about diet. We all think we know everything about the diet. A clinical dietitian, Shraddha Vijan, she's the part of our team who's the expert at nutrition, who's going to be helping our patients out who are going to be on GLP-1 drugs to understand what to eat, what not to eat, how to help with the side effects of GLP-1 drugs with nutrition. Is calorie deficit alone the only thing that a diet plan is supposed to do?
No, definitely not.
Right.
Another thing is all the cultural beliefs, because again we have a huge diversity. There are many vegetarians, vegans also in this world. So
Yes.
they would want to have their kind of choices.
So how important is hydration? How do we help patients maintain it? And is it just like drink this much water, right?
We teach them, we train them that later on in life, after 2 years, you might not need a Shraddha to kind of make those choices for you, but you are trained enough, you know the choices, because you were trained by Shraddha during that 3-month period or the 6-month period when you were on the drugs and you were needing that hand holding. Multidisciplinary approach towards this, because we are looking at different aspects. The person will have a mind, an emotion, a physical body.
Right.
So every faculty is an expert in that.
Hey guys, welcome to our next episode. This is something that's going to be really, really interesting. We all talk a lot about diet. We all think we know everything about the diet. A lot of patients who come to us for weight loss, they have had like so many diet plans throughout their life, and they think, oh, I know everything about the diet. Why do I need another diet plan? And it's all going to be the same thing: high proteins, low carbs, blah, 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 blah. And we know all of that. So today, what we're trying to do is sitting with someone who is an expert at this, a clinical dietitian, Shraddha Vijan. She's the part of our team who's the expert at nutrition, who's going to be helping our patients out who are going to be on GLP-1 drugs to understand what to eat, what not to eat, how to help with the side effects of GLP-1 drugs with nutrition, and a lot of other things as to what is important and what is not. So let's sort of decode the whole nutrition part of it, and probably you will be surprised by things that you don't know. So let's welcome her. Hi, Shraddha.
Hi, doctor.
Let's get into this. So basically, we are a MOH clinic where uh, we are looking at long-term sustainable weight loss. Now, the biggest issue for a lot of our patients, so I'll sort of get into it directly. The biggest issue for a lot of our patients is no matter what they have done, they have tried maybe 3 times, 5 times, 7, 8 times dieting. Earlier, they would lose weight when they were younger and when they started, and then they stop losing weight. Sometimes now the diets don't work. Even if they work, they lose weight and then the weight comes back. So for me, just give me one of the main reasons and the most common reasons you have seen that why these uh, patients suffer in spite of losing weight. Why do they get that back?
Okay. So this is like $1 million question that I
Yes.
keep getting asked time and again. What I would want to point out is many times these patients, clients, they put an expiry date
Right.
to these plans. They will see as a 2-month or a 6-month or a 1-year plan.
Right.
And after that, it just stops midway.
Right.
And then everything comes back. Another reason can be that sometimes they go really stark, like too much of starving, or not keeping enough of proteins or enough of the other nutrients into their diet, and once that thing wears off, it all comes back with vengeance.
Right.
So this is where we have seen that there is a lot of discrepancy in the kind of food that they are eating, and definitely they are putting a stop date to their diet plans and not taking it as a entire lifestyle change.
Okay, great. So lifestyle change is a word I think a lot of people use very loosely these days, and
Yeah.
it's basically changing the way you live. So it's actually a big change in the lives, and yeah, I totally agree that that lifestyle change is something that people don't look at it as. Uh, for me, another thing that I want to ask you is, as you said, that expiration date. So most of the patients come and tell us, oh, my diet plan only worked for 3 months, and then I stopped, तो diet भी बंद हो गया, तो वजन वापस आ गया. So these are things that we hear. Is calorie deficit alone the only thing that a diet plan is supposed to do?
No, definitely not.
so-
Because whenever we are looking into the entire diet profile, calories definitely is the first part.
Yes.
But where your calories are coming from is also equally important. Whether it's coming from your carbohydrate, protein, or fats, which are your macronutrients. Again, maintaining their balance is extremely important. You might be eating a 1200 or a 1400 or a 2000 calorie diet. But whether that 2000 calories are coming predominantly from fats or they are coming from an entire balance of all the macronutrients, which is your carbohydrate, protein, fats.
Right.
So this is where we see that not only the caloric restriction, but maintaining the balance become extremely important.
Okay, got it. So it's a lot more nuanced than just calorie in, calorie out sort of a thing. Yeah. So
Absolutely.
I mean, that's one of the biggest things that the certified nutritionists or people who sort of your best friend or your family member who's seen a few videos on YouTube would not really be able to tell you this. Okay. Another thing that I want to ask you, which is very important, is we as a MOH clinic. Okay, so this is something that a lot of patients would also want to know. Basically, what I wanted to ask, which was like something that I sort of felt very strongly about, but something that a lot of patients have a doubt with. On GLP-1s, they are going to be losing weight. We are not doing the dietitian part for you to lose weight. So what is the role of a clinical dietitian like yourself in this program?
Okay, so because this is a very specialized group that we are talking about who are on these kind of drugs.
Yes.
Here, basically, again, as we spoke earlier, the caloric matters,
Right.
yes, but the quality of food.
Yes.
In terms of the proteins, in terms of the balance, in terms of the amount of food that they are consuming, the number of times that they are consuming, I think this becomes very, very important into their weight loss journey, so that it's a healthy weight loss which
Right.
they can sustain for a longer period of time. And I think at this path you need a trained dietitian or a registered dietitian who can do that hand holding with the
Right.
patient.
Yes.
And take them ahead, and which can be much more safer for these people.
Yes.
I think that's where the nutritionist comes into play.
Absolutely. So, I mean, I think it's more about not just weight loss with a diet, it's more about maintaining health with a diet. So, for me, also, that is what I look at it as. A role of a clinical dietitian is not just to tell you, okay, you eat this and you lose weight, because, yeah, the drugs are doing that. But you're going to have a lot of other health issues if the dietitian's advice is not followed. So, yes, so great. So, let me come to this. Let's go back to like basics. So before the GLP-1 drugs came, so we are going to have patients who are probably not candidates for GLP-1 drugs. For these patients, what is your diet advice? So what are let's go like a very simple thing. What are the good foods? What are the bad foods? What are the simple things that we can start off with?
Okay, so these, which is the traditional method
yes.
that we look into, first of all is to just look into what kind of food choices are they making.
Right.
There is nothing known as a bad choice and a good choice.
Right.
It's just that, it might be bad at that period of time for your body.
Right.
So we have to assess that what kind of food patterns or that they are following, and what kind of food choices
Okay.
that they are selecting.
Right.
Something which is very high in simple sugars or simple carbohydrates or refined carbohydrates like maida or any kind of fruits over fruit juices. So
Okay.
these are the choices that they tend to make.
Right.
And this over a period of time, this is in terms of carbs. So you
Right.
have similar way in fats also, something
Right.
which is deep fried, something which is refried.
Right.
That is also contributing to a lot of calories. So this over a period of time, this kind of choices is going to push them towards that obesity path.
Right. So this was like actually what for a very long time before earlier
Yeah.
that people were treating, but this still is relevant because the basics do still stay.
Absolutely.
So say if I am your neighbor, or if I have a patient and I am their neighbor, I have not had any clinical, I'm not a doctor, I have not had any nutritional training, what is the one, or what are the few bad advices that you see like laymen give other people who are working on obesity, which makes them suffer? So basically, what is a bad nutrition advice in short?
खाना बंद कर दो और सिर्फ सलाद खाओ पूरा दिन. This is such a common thing that we have come across, and especially coming from people who are not trained into the field of nutrition and have absolutely no basis for. So this, in today's time, everybody is a dietitian.
Yes.
Everybody except for the dietitian, I think सब लोग dietitian का outputs दे रहे हैं. It's just that you need to make a wise choice that from whom are you taking this advice from.
Yes. So I'll tell you, it's actually not a dietitian. Everyone's a doctor. As far
Yeah.
as medicine is concerned, everyone will give you advice. So I tell people, take advice from people whom you can sue.
Oh yes.
Yes. So if you're paying them, you can sue them. You can take their advice.
Absolutely.
Okay. So now coming to like MOH Clinic, we would be doing assessment for patients. You would be doing assessment for patients, you and your team. How important is this pre sort of, before they start losing weight and before they get into this journey? What is this assessment about? How would you go about it and how important is it?
Okay, so whenever we see any kind of a patient or a client, and especially in these cases, because since it's going to be a very specialized group, so always the assessment is going to be on a basis of an ABCD. That is the protocol that we follow, which is the anthropometric measurements. It can be done by various methods. Very, very important right now is the body composition analysis.
Right.
That gives us a much better picture about their entire body composition. Then we have their biochemical assessments that we do. We do their entire diet recall and take their entire dietary pattern. I think this gives us a very fair clue when we are looking at that person from multiple angles,
Right.
which is going to be affected when they are going to be starting with this journey.
Yes. It will help all the specialists in the group when you do that assessment as well, because again it won't be that you're working in a silo. You'll be working with an endocrinologist, a health coach, a psychologist, and I think your insights into why something is happening is also very important for the other specialists as well, to sort of delineate their plans as well. So say what would be sort of your strategies when it comes to treating patients with obesity, this group of patients, and sort of give us like an outline as to how the programs would go under you.
Okay, so whenever we begin the person on this, we do the assessment, and followed by that is on the basis of their recall, on the basis of this assessment, and whatever is going to be our target.
Right.
We have to first set the targets also with them, get them on board on the same page, because then only they will open up and start following the diet plan.
Right.
When it comes to the specific diets, first is to work around with their calories, then into their macronutrient breakups, where these carbohydrates are going to come from, where these proteins are going to come from, where these fats are going to come from, what amounts they have to be taking it, at what timing they have to be taking it, and what is the safe gaps, what is the safe different parameters that they need to keep in mind when they are consuming the the whole plate. Because it's not going to be कि सिर्फ carbs खा लिया या सिर्फ protein खा लिया. That person is one person.
Right.
The food is also one plate. It's all going to come together.
Right.
So that's how we have to train them also, that how the balance has to be maintained and how they have to go about in that entire day with their quantity and the quality of the food.
Understood. That's great. So I mean, there is going to be a lot of customization for
Yes.
everyone that needs to be done. Okay. No, so in the previous episode, we have spoken about the side effects that come with GLP-1 drugs with our endocrinologist. Things, especially one of the biggest things that comes for every patient, because that is how the drug works, are the GI side effects. GI is basically your gastrointestinal, and that is where your food comes into the picture. So what are the strategies or what are the tips that are important for patients so that who are on GLP-1 drugs, how we can combat these side effects and how they can be kept to a minimum and they are more comfortable during the process, during the journey?
Right. So basically, these side effects generally start happening from the first or the second on the third week is generally what we have seen that they face these. Mainly is the nausea, vomiting, fullness, constipation. So this is all going to affect their oral intake also, the
Right.
food intake also. They might not feel like eating anything.
Yes.
This is where you have to actually train them that they have to take that small frequent meals,
Right.
a one dish kind of a meal which is nutrient dense,
Right.
because I have to at the end of the day meet up their caloric needs.
Right.
If they're not going to eat anything, it's not going to help them in the long run.
Yes.
So we have to work around with them. What food works for them, it doesn't work for them. Many times they have this smell issues also.
Yes.
Some foods like a lot of tadka or that masala can put them off. They
Right.
would not want to eat that kind of a meal also.
Right.
So there we have to tell them that how the food has to be prepared as well.
Right.
What is the gaps that need to be kept, especially in terms of the liquids and the solids.
Yes.
Because they don't want to fill up their stomach just with the liquid
Right.
and then not have the need of eating anything solid.
Yes.
Another thing is the food sits inside your stomach for a long time.
Yes.
So they have to be trained again that you have to get up, you have to move around a bit. And even if you like it or you don't like it, there are certain food items that has to be a part of your meals.
Right.
And you have to go ahead and take it in some way or the other.
Yes.
So these are the tips and the tricks that's going to help them pass this entire phase of, the side effects that they might be facing.
And with our country and our this thing, we live in Bombay, which is like a small picture of the whole of India. We have so many different diets, restrictions, diet needs, diet wants. Culture is different, and so would you be sort of changing it as per the patient's requirements, or is it sort of like a compulsion that they will have to have some foods and not have some foods?
Absolutely not. People have their own choices. So the initial assessment will only be taking care of this part, that what is their choices,
Right.
what is their likes and dislikes. Because if somebody is not going to like some food item, they are not going to go for it.
Right.
This is what happens even when we look into the entire weight loss as a journey.
Right.
They look कि ये punishment कब खत्म होगी,
Yes, very true.
and when I can start eating again. So we don't want that entire negative feedback about food with these kind of patients. So you have to kind of take their choices into picture, keep them on the same page as you, make
Right.
them happy and enjoy their food, because food is to be enjoyed, not to be scared about.
Yes.
So this is when you are not in sync with them, when you are going to force things on them, you are going to get a very negative feedback, and they are not going to follow it. And that's where the people kind of lose that entire touch with that entire nutrition program, because they cannot connect with you on those aspects.
Right.
Another thing is all the cultural beliefs. See, I personally always say that I would not want to come into your cultural beliefs or what you want to eat or not eat. I will give you choices on both the sides of the coin.
Right.
You can make a good decision that if you want to go with this one or with that one.
Right.
My role is to give you the choices, as many as possible.
Right.
So I think this is where the entire diversity has to be considered.
Great. I mean, so that's actually something that is also quite sustainable, because this is something that they don't have to just do till the time they're on the medications as
True.
well. They have to do this for the rest of their lives.
Absolutely.
Yeah? Okay. So something that we hear a lot. One, what is the role of proteins and how much proteins, and also, like vegetarian sources of protein, and what kind of meats are good and what kind of meats are something that you would want patients to take in moderation. So you can sort of tell us about these a little bit.
Okay, so proteins are again very, very basic building blocks of the body.
Right.
Everything in your system is going to be based on your protein intake.
Right.
Over here, whenever we go by the protein intake calculation, we consider the body weight of the person, the ideal or the targeted body weight.
Right.
That is considered for their the
Yes.
protein requirement. It can range from anywhere from 1 to 1.2. It
Right.
can even go up to 1.5 in certain conditions where we know that their physical activity or their workouts are going to be that strenuous.
Yes.
So that is where we consider the protein requirement, the quantum. Now we look into what is the sources of the protein, because again we have a huge diversity. There are many vegetarians, vegans
Yes.
also in this world. So
Yes.
they would want to have their kind of choices. So vegetarians, we mainly look into the first class quality of proteins, which can be anywhere like low fat dairy or
Right.
any dairy products,
Right.
lentils, pulses, soy products are again very good sources of protein. Again, the combination of protein is important. There will be some sort of protein which would be deficient in one amino acid and another substance will be higher in that one.
Right.
So you combine it together and you give it to them.
Right.
So that's the way we go about with vegetarians.
Right.
When it comes to non-veg, because they have entire first class quality protein at their
Right.
disposal.
Right.
It can be white meats, it can be chicken, it can be fish. The way you prepare it becomes very important. You can even have mutton, but again the red meats or the
Yes.
organ meats, they are very high in fats.
Right.
But again, the moderation, what time you want to give it to them, or what sort of set of patients you want to give it,
Right.
that also matters. Again, it is very individualistic, very personalized. Somebody who is of that culture,
Right.
where they have a lot of non-vegetarian foods,
Yes.
there suddenly I cannot stop all their red meats altogether.
Right.
I would want to maintain a balance, again because I want them to be motivated enough to continue
Right.
doing it.
Yes.
So there is where you have to use your tactics and convince them and come to a middle ground. So
True.
as I said, there is nothing as a bad food.
Yes.
You just have to fit them in a correct way into their eating pattern.
Great. So basically, protein. So with proteins, one thing that I hear even a lot of doctors talk about is, nahi vegetarian ka ya even vegan. So I myself am vegan, and they always talk about ki you're not. There is no way that you can get 1 gram per kg per day. Forget 1.5 gram per kg per day with just this, and you will definitely have to go on protein powders. So are protein powders a very bad thing? Are protein powders that can be given to patients, that you would give to patients, especially these patients who, their appetite would be definitely low on GLP-1s. So are protein powders are an option that can be given to patients, or do you feel that diet sort of will cover most of the things that they need?
So basically, whenever we give a meal plan, okay, after that we take a entire recall also. We ask them to come back to us,
Right.
so that we know that what's happening with them, how much they are able to consume.
Right.
Now you have set a target, you know how much they are consuming.
Right.
If there is a gap in the middle, you have to fill up the gap. And let's be practical. If you have certain food items which are available,
Right.
and which are very scientifically proven and safe, why
Yes.
not use them? You
Right.
don't need to be shy about that. And it's bad, nothing. You just have to select the correct one. You should
Right.
know what is the contents of the protein, where is it coming from, where that powder is getting actually manufactured. And that is where the nutritionist role come into play,
Right.
because she's the one who's going to be doing all this backhand calculation and seeing what is safe, what is not safe as
Right.
per your condition. And this gap is then filled up with a supplement. So
Perfect.
again, I feel that I do not want to shy away and not use something where it's going to be beneficial for that person just for the sake that nahi dena hai,
Right.
if their diet is not able to meet it up.
Yeah. Yeah, I mean, that's something that a lot of patients also come and tell us, ki, nahi, we want to have protein powders. And I think the role of a clinical dietitian to make them understand ki why it's important, why proteins are important, it's very important that we do that. Coming to another part of your diet, which is hydration. So we spoke to Dr. Hati about, who's an endocrinologist, about things like, kidney failure, acute kidney failure, and one of the main reasons for that being that patients are low in hydration. Patients having muscle cramps can also happen. Patient having other electrolyte imbalances can happen, especially if they have dehydration, because your patients can have vomiting, patients can have diarrhea, all of these things. So what, according to you, so how important is hydration? How do we help patients maintain it? And is it just like drink this much water?
So again, hydration extremely important, because many of these, the effects can get aggravated when the hydration status is not maintained well. So in these cases, what we normally see is they struggle कि कब पानी पिएं. पीने का मन ही नहीं कर रहा है, यहाँ पे you have to give them again some kind of nudges,
Right.
that put in some alarm in your system or on your phone, that's something that keeps reminding you that you have to keep on drinking water, because this is something that we face in day to day life also with many
Yes.
of the people. They do not drink that much amount of fluids, but in this cases it can be extremely detrimental. There they have to be first counseled
Right.
that this is important for you. Again, you like it or you don't like it, you have to go for it if you want to keep your systems in check.
Right.
So again, if they do not like, sometimes some people do not like the taste of water.
Acha.
They
Okay.
would, yeah, I've got patients like that also. They say कि पानी पीना ही अच्छा नहीं लगता, टेस्ट ही अच्छा नहीं लगता.
Right.
So यहाँ पे you again have to kind of कि चलो थोड़ा सा नींबू डाल दिया आपने, you have made
Right.
a very thin छाछ, or you have given them very thin soups that they can have, that gives them some kind of flavoring.
Right.
That at least that way that entire fluid is going to go into their system. Obviously they would need free water also, that is plain water that they
Yeah.
need to drink as well, and to keep the gaps between the solid and the liquids.
Right.
This is again very very important for them to understand. But yes, I think hydration is something that always has to come into the prescription of a dietitian's diet plan.
Okay, great. So, I mean, that would also help patients avoid a lot of serious side effects. Another thing that is actually not spoken about, and a lot of patients miss out on it, and I think a lot of doctors also miss out on it, which is micronutrient deficiencies, especially patients who are going to be on probably half the diet nutrition that they require, because on GLP-1 drugs is going to suppress their appetite. So what do we do for these patients? How do we sort of work out for these patients? And what will you be doing to assess whether they have micronutrient deficiencies? What will you be giving them for that? So can you just throw light on that?
So micronutrient deficiencies, again, it's a very common thing to occur even for normal individuals. But in this cases, it does occur is because of the quantum of food that has gone down. So the entire food is not present for them to give that much amount of nutrient which is needed by the body.
Right.
That's where the deficiency occurs. Micro, because they are needed in a very small portion. But again, they are present in the food also in a very small portion as well.
Can you give us some examples of micronutrients?
So like B12, iron, magnesium is something
Yes.
that we commonly see. D so is
Yeah.
like a universally present
Right.
deficiency again, which we have normally seen. But correcting them becomes extremely important. For correcting them, you should know that how much is the deficiency first of all.
Right.
That has to be assessed through their blood investigations.
Right.
We do not do any random supplementation without knowing the baseline values,
Right.
which is again very very important, because some of the nutrients can get into a toxic level
Right.
if not monitored in a correct way. So I think at baseline, to do their assessment in terms of the micronutrients by blood test, seeing for their some symptoms that they might also show, can also make us think that okay, this is the nutrients that they can be deficient in. And I think at routine levels they need to be kept on assessing for these through blood
Yes.
test, and then keep on correcting them,
Right.
where the supplementation, a mega dose supplementation also helps.
Right. And you will be taking care of all of this for these
Absolutely.
patients. Yes. Okay. The next thing I want to ask you is, there's something that, like basically the gist of all of this. So a lot of these patients are going to be very low on appetite. A lot of these patients are not going to be taking a lot of food. That is one of the mechanisms for weight loss. And so you as a nutritionist will be following them up and doing what is needful, or is there something else where they need to do on their own? Or, I mean, you would tell them that, you just do this, and whether the hand holding happens for the entire period where they are on GLP-1.
To be very honest, this is the period whenever they are with any kind of a nutritionist or following up with any person. I think this is the golden period where we do the hand holding.
Right.
We teach them, we train them, that later on in life, after 2 years, you might not need a Shraddha to kind of make those choices for you, but you are trained enough, you know the choices, because you were trained by Shraddha during that 3 month period or the 6 month period when you were on the drugs and you were needing that hand holding.
Right.
I think this is the chance for us also to make them aware, to put them on a right path,
Right.
because the entire game is, it starts when they are off the drugs.
Yes.
So this is just the start part. They
Yeah.
are just loading it up.
Yes.
That entire thing is going to come out later, and they have to be ready for that.
Absolutely.
That is where our role also comes in, hand holding, teaching them, and at the same time learning, for them to learn how their body reacts to certain food items and it doesn't react to certain, what works, what doesn't work. And at the same time to make it sure that whatever this period is, it's a healthy weight loss or the healthy weight management period for them, which
Right.
they can sustain it for later. This we normally do with regular follow-ups,
Yes.
asking them to maintain the diet journals, the food
Right.
journals, clicking some photographs, because sometimes they are so scared that that photograph is going to go to the dietitian.
Right.
They are really scared, so
Right.
they will eat correct
Yes.
at that time also.
Okay.
So these are some ways that it helps them to be on the line also, and helps us also to keep them in check.
Got it. That's good, because so that was what I was coming to. This is basically like the exit strategy, because we want patients to go off these medications. We don't want our obese patients to be on these medications, and for that, lifestyle is absolutely essential. We can put patients on long-term maintenance dosing, but we would always want to try putting patients off that. And I think for that, change in diet is probably the most essential thing that they will have to do. Change in mentally thinking about how they think about food, rather than let's do this, and as you said, they look at it like a punishment. So for them, cheat day is a very good day. So those lexicons also need to go out of this thing, that those words need to go out of the lexicon, that this is cheat day, which is a good day.
Yeah.
We are doing dieting. I tell patients, don't say you are doing dieting, say you are eating food. If you are eating
Absolutely.
junk food, that is junk food, that is not cheat day.
Absolutely.
So
Agree.
it works. And so finally, like at MOH clinics, you've worked for a long time as a clinical dietitian. For you, how important is a multidisciplinary approach, where we have an endocrinologist, we have a psychologist, we have gym trainers, all of these people working together for the patient? How important is that, and is that really essential for long-term weight loss?
Extremely important. That is
Yeah.
the word. It's extremely important to have a multidisciplinary approach towards this, because we are looking at different aspects. The person will have a mind, an emotion, a
Right.
physical body.
Right.
So every faculty is an expert in that.
Yes.
So when we take them on board for that one person,
Right.
they know everything is getting covered and going to be in safe hands.
Yes.
So that is very, very important, because as I said, diet alone cannot work if there's not good enough of exercise, not a correct dosages obviously by the
Yes.
doctor, and the third part is
Psychologist.
psychologically they are not in that entire frame of mind to
Yes.
accept anything. किसी ने बोला कर लो, इन्होंने बोला कर लो, बट खुद का मन नहीं माना है. There is where that psychological training then becomes extremely important. Once all of them have worked on that person,
Right.
I think it's a smooth sail for them then.
Great. So, I mean, I think we have discussed a lot, and hopefully, this gives a lot of our patients clarity about why diet and GLP-1 are important, why GLP-1 is not a standalone thing, why you cannot just be that I'll have this and I'll grit through my diet and I'll do what I have been doing. There are a lot of nuances to it. There's no standardization in diets. So, thanks a lot for sharing all of this with us. And
Thank you.
so guys, if you want more info, keep watching the channel, and there'll be more and more things with Shraddha to talk about diet, and with all of our other specialists talking about their specialities.